I said it before a few times on this programme, but having myself read or watched or listened to all of the contributions made at the Oireachtas Committee tasked with looking at the issue of assisted suicide and euthanasia, it absolutely baffled me, purely from a journalistic perspective, that our government would actually recommend its introduction based on the just swathes of evidence that was presented to them on things like the horrors of this type of legislation that we have seen in countries like Canada, for example. And just days ago, a committee in the UK was set up to scrutinise the assisted suicide bill, which MPs voted in favour of this in the UK in November. And obviously we're looking to hear to say, well, what is going to happen next now that there has been a recommendation? It's great to have with us on the line Niamh Uí Bhriain from the Life Institute. Niamh, there was so much evidence given at those committee hearings which lasted months. What were your overall concerns that were raised but unfortunately seem to have fallen mostly on deaf ears?
Well, yeah, it's very interesting because I suppose what happened really is that after Canada legalised assisted suicide, the evidence that is coming in particular from that jurisdiction is so disturbing, Wendy. And I think it kind of has brought to the foremost in people's minds, like that this is no longer something that is rare once it is legalised. Like the rates in Canada have increased 12-fold, like the number of cases that we're seeing emerge, even in the media there, which is very supportive of assisted suicide, of people who are ill, but who have an illness that is not terminal, but an illness that requires assistance from the healthcare system in Canada, and who are being offered assisted suicide instead of being helped to live. All this very disturbing, I think, stories that are coming out are catching people's attention. But you are entirely correct in that, like when the Oireachtas Committee heard evidence on this issue, it was really, I think, so interesting to see that the medical bodies were pushing back against legalising assisted suicide. So you had like the Irish Association of Palliative Care, you had the Royal College of Physicians, the Irish Palliative Care Consultants Association as well, actually, the College of Psychiatrists in Ireland, all going in and giving evidence saying, basically, if you wanted to sum it up, that assisted suicide was endangered people who are elderly or sick or vulnerable. And they, of course, pointed to the evidence as to what, in regard to what was happening in other jurisdictions. But they also pointed to a lot of, I think, new evidence in relation to the effect on society's view on suicide in general. You know, if legalising assisted suicide, for example, undercuts then the idea that we should try to prevent suicide. Like, all of these very interesting arguments were teased out, and the medical experts in this country came down very, very heavily against legalising assisted suicide. Yet you have TDs then who blithely went in and, you know, supported the report that came from the Oireachtas Committee, which could give the nod to legalising assisted suicide in Ireland. So I think that we've been told for years, Wendy, on a lot of issues that we need to listen to the science and we need to listen to the experts. But when the experts are overwhelming in stating that they don't believe assisted suicide should be legalised, it doesn't seem like the media or the TDs really want to listen to them. And that's part of the reason, of course, why we're having this conference on March 22nd in Dublin.
And I know one of the speakers at the conference, Niamh, is Professor Patricia Kay. She's a psychiatrist. I suspect is echoing what I heard many, as you say, the College of Psychiatrists recommending totally against this. What are some of the things that she might touch on?
So obviously Patricia Casey is a very well-known speaker and somebody who would be very, very highly regarded in the Irish field and internationally. And she has spoken on this issue before, because it was an argument that was made in regard to assisted suicide, was that if you gave people choice about ending their lives, that would then help people face up to their problems and actually reduce the rate of suicide in general. And, you know, I have to say, Wendy, people listening to that argument might think, God, that sounds like nonsense, because clearly any normalisation of suicide doesn't help to bring down suicide rates, and they'd be precisely correct. And Patricia Casey and another psychiatrist, Anne Doherty, and others, and working with, I think, some colleagues abroad as well, have spoken out very strongly on this and have published some very interesting papers in this regard, where they have shown, in fact, that legalising assisted suicide did not bring down the rate of suicide, and in fact increased it in several jurisdictions. And that's, I think, a hugely interesting conversation that we need to have as a country, because everybody, I think, Wendy, is concerned about suicide rates. And, you know, there are very few families in this country that haven't in some way been touched by the absolute tragedy of suicide. And we're trying, I think, to come to a better understanding as to why, in particular, so many young people, in particular so many young men, are taking their lives. And I think what Patricia Casey and other very experienced practitioners are trying to show us is that it is almost impossible to argue that for one group of people, suicide should be something that is supported, and that doctors, in fact, must carry out the ending of that person's life by assisted suicide if that's what that person wants, and then try to pretend there's another category of people for whom suicide is a bad thing. And that kind of mixed messaging doesn't work. It clearly doesn't work. If you're normalising suicide by saying that medical practitioners actually have to help you end your life, then how can you then say, on the other hand, that suicide is wrong? And that's an aspect, I think, that we'll be looking at in the conference and teasing out. I think it's very, very important for people to understand that. Like, nobody wants to see the rate of suicide rising even further. But if we are passing laws and arguing as a society that sometimes you should in fact be helped to end your life, you're sending a mixed message there that's really, really dangerous.
I know, obviously, myself and yourself, Niamh, and a small group of others paid close attention to evidence given here at the Oireachtas committees here in Ireland from, as you say, the vast majority of medical professionals working at the coalface in this area, purely coming, you know, I really felt they were coming from their kind of medical experience in terms of what's best for the patient, whether it was palliative care doctors or, as you say, psychiatrists, geriatricians, all of that. But for most people, they might have just got a snapshot of some of the headlines, which really didn't focus on the evidence that was given and kind of focused on really difficult and emotive stories for those pushing for assisted suicide. So being informed
opposition to assisted suicide, and that's what we're hoping to bring together at this conference on March 22nd.
Well, Niamh, thanks so much for joining us on the show today, and it sounds like it's just a really important conference on such an important issue. It's called the Assisted Suicide Harms Us All Conference. It's taking place on Saturday the 22nd of March at the Thomas Pryor Hall. That's the Clayton Hotel in Ballsbridge from 10 a.m. to 1 p.m. and you can register for your place at thelifeinstitute.net, and that was Niamh Uí Bhriain of the Life Institute.